The Affordable Care Act of 2010 mandated the U.S. Centers for Medicare and Medicaid Services to institute a value-based purchasing policy that links hospital reimbursement to care quality measures. The value-based purchasing policy began in 2012. One category of the survey is based on the patient's experience of care. The patient experience of care is measured through patient scores from the Hospital Consumer Assessment of Healthcare Provider System. This comprises 30% of the total quality incentive. Hospitals are at risk for losing 1% of their base CMS payments if adequate achievement or improvement to CMS scores is not achieved. Incentive payments are given to hospitals that achieve high quality rankings, including high patient experience ratings. Hospitals are reimbursed based on the percentage of their patients who select the highest possible score, or top box score. If a patient provides a response of 8 on the 0 to 10 point satisfaction score, the top box percentage will be 0. According to the surveys that we have received from our patients, they are not always gaining a full understanding of the education they are provided about new medications and their side effects. For the past 3 months, our organization has fallen below the internal and external goals for this education. Our internal goal for this measure is 70%. The goal set for us by CMS is 64%. Although the staff feels that they are providing adequate education to the patients, it is the patient's perception that is important, and that perception is that the education is not sufficient. As a system, we must closely examine our organizational characteristics as well as our performance data to further determine what changes are necessary. Our medical professionals must understand that communication is a key element in today's healthcare system for patient safety, quality care, and financial aspects. The current HCAHPS survey that is sent to all of our patients that are discharged from the hospital, there are 2 questions that address medication education. Question 16 asks, before giving you any new medicine, how often did hospital staff tell you what the medication was for? Question 17 asks, before giving you any new medication, how often did hospital staff describe possible side effects in a way you could understand? The answers for these questions are never, sometimes, usually, and always. The only answer that counts for us is the answer of always. 95% of the responses we receive are either always or usually. We have to sway the responses of usually to always in order to improve our scores and the patient's perception of the education we provide about the medications. Our organization instituted a plan to improve the scores in the domain of medication education. Leadership, physicians, nurses, and the pharmacy team members are all involved in educating patients with the information that they need to know about their medications. Pharmacists verify initial medication reconciliations upon admission and educate patients about new medications during their stay. Leaders round on patients and routinely ask them about the medication communication that they have received during their stay. Staff are provided with medication guidebooks to help them present correct information on the medications. A random symbol is placed on the whiteboard in the patient's room to show the staff that a new medication has been introduced to the patient. Throughout the patient's stay, continuous education is given to prevent overload of information at the time of discharge. Although our current innovation seems to be leading us in the right direction, there is always room for improvement. We must be able to communicate with all of our patients. We must be able to measure their level of understanding. We want to ensure that their questions are being answered and that the options we are discussing are in line with their individual goals of care, so that they are more likely to actually undertake them when they go home. Yes and no questions show little when assessing a patient's understanding of information. As a matter of fact, many patients answer yes just to avoid looking ignorant. One educational method that successfully addresses communication gaps is teachback. This strategy allows providers to ask patients to repeat or teach back in their own words what they have just learned about their medicines, treatments, illnesses, and care. An example of this method could be a nurse using the teach-back method and asking a question. Mr. Jim, can you tell me why you are taking this antibiotic? Teach-back is not just a tool for nurses. It should be utilized by all members of the healthcare team. All members of the team play an important role in assessing if patients understand the instructions they have been provided. Lehigh Valley Health Network, a 988-bed, 3-hospital system based in Allentown, Pennsylvania, began using the teach-back method to target improvement in the quality initiative. They wanted to reduce readmissions. They created a standard work process using teach-back strategies across the healthcare system, with training offered to all professionals who provide education to patients and families. Results have reduced hospitalizations and have even shown that those who are readmitted on their second admission had a shorter stay. Nurses and physicians commented that they loved the interaction and the ability to teach the patients. Large volumes of important information often are given to patients as they leave the hospital. Many patients don't find this a sufficient amount of time to assimilate the information that they are given or to ask questions. Such situations are especially common at discharge, and although physicians and other care team members might feel they can't afford the time to assure themselves that the patient understands what they are saying, the alternative is a lot more time spent dealing with preventable crises, misunderstandings, and preventable readmissions. The teach-back process begins when the patient is admitted to the hospital. Education is presented in small segments. These segments can be repeated and monitored for understanding. Studies have shown that using the teach-back method for medication education about the use of the medications and the side effects has closed gaps in the patient's knowledge base and ultimately improved their overall satisfaction and stay during their visit. One study concluded that 93% of the patients believed the teach-back method improved their quality of care. A second recommendation that will help with medication education is a practice called M in the Box. M in the Box is known to increase patients' perceptions of communication about their medications and their medication side effects. This process would take the place of the random symbol that we are currently using on the patient's care board. When a new medication is ordered, the nurse taking care of that patient would place a bright red M in a box on the patient care board. The M symbolizes that the patient has now been introduced to a new medication and has received some education about that medication and its possible side effects. Other team members, seeing the red M in the box, will acknowledge that the patient has received the new education and will ask them questions regarding that medication. Once the nurse feels that the patient totally understands the information that has been provided to them, the M can be erased and the whole process can start over again. Research has proven that patients have lower readmission rates when they are educated about their medications. Patients have a right and need to know their medications and possible side effects, Education about medication is known to increase HCAHPS scores. One risk that the organization may face with the introduction of M in the box and for the process of teach-back may be the staff's unwillingness to change. They may feel that it is just another added thing that they have to do and may feel that they don't have time to do this. Using effective communication with employees will help with this disengagement. Engaging staff in the change process will ensure that they understand how their actions and behaviors impact outcomes. The financial impact of this new plan will be made understandable for all. Reward and recognition will be used to encourage a culture of safety, connecting to passion, purpose, and the worthiness of each individual's work. Monitoring for improvement is an important part of a change process. To monitor the improvement of the patient's perception of medication education, we will continue to monitor the monthly HCAHPS scores. Scores will be analyzed for specific responses, and implementations will be adjusted as needed. Charts showing weekly scores will be posted for all staff to see. Keeping them informed on the progress will continue to create a buy-in to the change. Patients who are readmitted to the hospital will be asked a series of questions to see if perhaps the medication education was part of the reason for their readmission. Using this information will help discover if the new processes are working on patient engagement. As the process change is implemented, leaders will continue to round on patients and staff to monitor their thoughts on the new initiatives. Rounding on patients will occur daily to give staff an opportunity to recover the patient's knowledge if it is not what it should be.